we are going to start the features of clavicle bone. The clavicle has a shaft and two ends. The medial end is also called as sternal end as it gives attachment to the sternum, and the lateral end is also called the acromial end as it is attached to the acromion process of the scapula. So first of all we will discuss the shaft. The shaft is divided into medial 2/3 and lateral 1/3 part. The lateral, first of all we will discuss the lateral 1/3. The lateral 1/3 has two borders, the anterior border and the posterior border, and two surfaces, the superior surface and inferior surface. The lateral 1/3 is flattened from above downward. So the two borders, the anterior border and the posterior border, the anterior border is concave forward and the posterior border is convex backward. The superior surface, it is subcutaneous, so we can feel it. The inferior surface has an elevation which is called as conoid tubercle and a ridge which is called as trapezoid ridge. This is the lateral 1/3 part. Now the medial 2/3 part. The medial 2/3 of the shaft is rounded, so it has four surfaces: the superior surface, inferior surface, anterior and posterior surface. The anterior surface, it is convex forward, and the posterior surface, it is smooth and it is concave backward. The superior surface is rough in its middle part. The inferior surface has a rough oval impression as you can see here in the medial end, and it has a large longitudinal groove. There is a nutrient foramen also present in the inferior surface of the medial 2/3. The ends of scapula, there are two ends. The lateral end, which is also called as acromial end, it is flattened from above downward. It bears a facet that articulates with the acromion process. This is the facet, and it makes the acromioclavicular joint. The medial end or the sternal end, it is quadrangular and it articulates with the clavicular notch of this manubrium sterni and it makes the sternoclavicular joint. The articular surface, it extends downward and it also articulates with the first costal cartilage. So the medial end forms the sternoclavicular joint and also articulates with the first costal cartilage, and the lateral end articulates with the acromion process and it makes the acromioclavicular joint. So this is all about clavicle, which is the first bone of upper limb.